Good morning, everyone. Welcome to today's episode of Tooth Teacher Tuesday. I'm your host, Dr. Steven Zahm, and today coming to you with another edition of our Oral Pathology Corner. Today talking about a condition that we've talked in the past a bit about smokeless tobacco keratosis, the little white patches that sometimes develop from using chewing tobacco. And today's topic is something similar, but still a little bit different, and it's a pathology known as submucous fibrosis. And essentially what submucous fibrosis is a condition where, similar to how chewing tobacco irritates the gum tissue, creating those white and sometimes red patches, we kind of have the same thing going on here, where something called betel quid, which is used similar to chewing tobacco and in fact sometimes contains tobacco, but its primary ingredient is derived from the areca nut. And it's a habit that's primarily seen in Southeast Asia. So you think India, China would be the main examples, but some of the surrounding countries as well. And a lot of times that habit isn't just localized to those countries. Anyone that immigrates to other parts of the world will often continue that habit, and that's part of why I came up with this topic. Is here on the south side of Indianapolis, we have a lot of immigrants from Burma. We have a large Burmese population, and this is something we see from time to time. And essentially, what happens with submucous fibrosis is, while using these little packets of betel quid, instead of creating little white patches, the tissues, primarily along the cheeks and the soft palate, will start to get more pale and kind of stiff, lose their elasticity, and can sometimes even have a bit of a burning sensation to them. And so it's going to look a little bit something like this. And yeah, it's certainly a little bit more problematic than chewing tobacco. Fortunately, chewing tobacco, a lot of times if you discontinue, the patches will go away. With submucous fibrosis, this typically, even if the betel quid is discontinued, these areas affected will not really get better after discontinuing. And it's extra problematic because submucous fibrosis is pre-cancerous, and so it's certainly something that it's still a good idea to discontinue to prevent any further mutation of the tissue that could cause cancer. But again, it's not going to get better on its own and is going to leave you somewhat predisposed. So, like I said, similar to the little patches that develop keratosis with chewing tobacco, but different product, different outcome, and so certainly in both cases something we monitor to make sure it's not developing into cancer. So, hope you found this useful and informative, and if you're using betel quid, do yourself a favor and please stop. But as always, if you see something suspicious in your mouth that you might think is some kind of pathology, certainly check with your dentist to confirm that. So, hope everyone has a great week. Thank you for joining me, and I will see you on next week's Tooth Teacher Tuesday.